All opinions and views expressed by the speakers are not representative of views and opinions of RBC Dominion Securities, Inc. All information and opinions provided in this video are in good faith, but without legal responsibility.
Dr. Jalal Abouhassan, thanks for coming on the podcast.
Thank you.
I'm proud to say that you were the first dentist on the podcast.
Oh, nice, good.
But I think that this was appropriate because I feel as though, from a business perspective, you look at things differently. And that piqued my interest. And it really felt like this was appropriate. So thanks for coming on. Thanks for coming to my house.
Thank you. Beautiful home, by the way.
Thank
Beautiful.
you very much. We worked hard on it. But today I want to start with you. I want to talk about where you kind of came from and about Glenora Circle Dental. Tell me about what you guys are trying to do there.
So, a little background on me. 2025 will be my 10th year practicing dentistry, all in Edmonton. I went to dental school in Chicago and fell in love with that city, but my roots, my home, my family is all in Edmonton. Was a lead dentist at a corporate dental office for about 7 years there. My whole life has been in the West End, and so obviously with the opportunity that came up at Glenora Circle itself, I thought it was a great opportunity to jump on. I actually went to high school at Archbishop MacDonald too, so literally my old stomping ground. So for me, first ever office kind of opening up, always envisioned doing dentistry a certain way, providing a certain level of care for my patients that I thought was needed, especially because of, when you work in an environment where you're just an associate there, you can kind of make some decisions, but being able to implement your own vision, your own motivation for why you want people there and how you want them treated is something I didn't want to pass up on. And having the opportunity of being in the West End, close to my home, close to family, friends, it was an opportunity I didn't want to pass up on. So,
well, that to me is important for every small business. It feels that having control over the direction and story is important. If it's not only to last and to be able to do it for a long enough period of time and not hate it, but in order to be motivated every day. And you can definitely feel it and see it when you arrive at your practice.
Well, I appreciate that. Thank you. Yeah. Like for us, when I started the practice, the first thing was I need to be able to see people. I need to make sure all my machines are working, everything's calibrated the way we want it. Now what we've been starting to implement is our values into the practice. Now you got that when you walked in and you got that from the care, but it's now implementing those as systems, non-negotiables for us as a team. So our three main values and goals is obviously the commitment to growth, accountability with heart, and providing just exceptional care. So for us, the exceptional care part comes from educating you guys, teaching you why you need a certain type of procedure done via either our 3D scan or taking intraoral photos. Accountability with heart is more for us, that we have to be accountable to our teammates and everyone that we bring into the practice. Because if we can't look at our patients and feel that we can hold ourselves accountable for your care, it's very easy to see through that, right? The biggest thing a lot of patients tell me is, I feel like you actually care. Because I do. Like I sit there and I want you to understand what you're going through, because I know being at the dentist is not fun. I don't like being at the dentist. Nobody likes being at the dentist. So just trying to be accountable with everybody from our patient base to the staff itself, but commitment to that growth factor and just always doing what's new and better in dentistry. So right away I said I wanted to get a CBCT, for example. So that's a 3D x-ray that allows me to know if I want to do implants right away, if I see a level of an oral cancer possibly. It allows me to detect things a little bit better. We have our 3D intraoral scanner that lets us show you, Joel, look at what your teeth look like. Like this is a perfect example of where you have issues, concerns. And just always adding things that we think would be beneficial to the practice, right? Because I used to be very aware in certain places that I would be at of there was a focus on producing, but it wouldn't go back into the office. So we would be using the same things we were using 5-10 years ago in terms of tech. And I don't want that to be this practice, right? I want us to always continue to evolve and get better.
So recently I listened to a podcast on the Invest Like the Best series. And they had Ronnie Thag on, who owns Kith. Kith is a lifestyle brand. They do collaborations with businesses from BMW across to Adidas and whatnot. So he was on to talk about his process. And the one thing that stuck with me was the reward for great work is more work. And it kind of feels a little, it's a little, I think for people that want to retire one day, it feels wrong to say something along those lines. But the idea really struck home with me, because if you can commit yourself to doing something great, and the result of that is you end up loving it because of whether it be other people's admiration for your work or them referring business to you. But the sad part is that what it doesn't do is force you to retire. It actually does quite the opposite, and it just drives you doing it more. It brings more patients into your practice. It makes you want to continue and to build off of it. And it is a beautiful flywheel effect of just you being forced into doing more. But it truly is what you're looking for, right? And what I really grabbed from that podcast, but see it in what you're doing there, and it's his belief in always having great product and pushing, basically collaborating with some of the greatest brands on earth and earning his way into not just their business, but the people that buy his products' lives. And if you can do and earn your way by doing good work into your patients' lives and people in the area, I think you can build just a fantastic brand. And I think you're doing a very, very good job.
You know, I 100% agree with the idea that pushing oneself only makes you work harder. It doesn't actually allow you to kind of release yourself from the business that you're in, because then once you actually invest that time, invest that blood and sweat into your career, you feel like, oh, I have something that I can do better now. And it's always just this constant belief that you can elevate yourself, whether it's in a day-to-day aspect of the office or behind the scenes, where I'm trying to, for example, when you're talking about working with other brands, that's what I'm trying to do at GCD. I'm trying to work with the best type of, for example, dental supplies for our patients. I'm trying to work with brands that I use at the practice that I think could help clinicians like me. So I'm trying to be a brand ambassador as much as I can, because I feel like if I enjoy something, I want other clinicians to enjoy it. If I think it's beneficial, I want my patients to enjoy it. So I agree with that. It is it's a cyclical process. You think you're done, and it just keeps going and going.
You're never done. Yeah. If you're doing the right thing, you'll have more work ahead.
I agree.
Right?
Yeah, 100%.
I want to talk a little bit more about the business, a little bit about the opportunity. We can either take this towards what's going on in Edmonton, or more broadly Alberta, and even Canadian dental and the practice, or we might end up as deep as the different tech companies that are providing new innovative products and whatnot that's finding its way into a dentist practice. As a layman who views the industry, I'm always interested in it. It feels as though a typical doctor's practice has stayed fairly similar from my point of view as a consumer for the last 35 years. I'm 34 years old. I feel like every time I've gone to the doctor, it's been a very similar experience. You go and you have a waiting room, you have a hallway where you have multiple different rooms that you go into. However, when you look at the dentist's office, I feel like from the time I was a young boy going to the dentist to today, it has changed dramatically. It is nothing like it used to be. When I think back to my when I was 7 years old going to the dentist, they had I mean, you'd have some Archie comics in the center and no windows in the room. And it wasn't the same as it is today. When you walk into your practice, you have this big, beautiful foyer, and that is really quite inviting. There's so many things that are being thought about. And that's an interesting approach. I think that it's beautiful because you guys are clearly out here competing for the customer, and the consumer experience has evolved. Tell me where you viewed that going, because to me, it's quite the opportunity. I view it as this is possible, where if we can figure out our healthcare system in Alberta, it could go. However, I find it ever interesting that dentists are willing to adjust and iterate, to adapt to what the customer is looking for, either to make a little bit more money, but to provide a better service and utilize their facilities.
Yeah, I mean, I think, well, first I appreciate the comment. Yeah, I did spend a lot of time focusing on design, aesthetics, trying to make it a welcoming environment, because like I stated, it is really important to make someone feel comfortable, because the dentist, when you look at the top 5 things that people are afraid of, dentistry is right up there with public speaking and skydiving and all these things, right? And so phobias, needle, which in the end, once you find, I akin us to having a good doctor, a good barber, someone that you rely on for your aesthetics, your health. You will travel distances that are immeasurable just to get to that person that really kind of understands you and makes you feel comfortable, right? So yes, I wanted to say thank you for that comment, because I really did focus on that, and I appreciate that you focused on that detail there. But I think dentistry is going more like my vision for GCD as well, but not only my office, but where I see a lot of practitioners such as myself, young guys that want to just do clean, good dentistry for all age brackets and all categories, aesthetics and things like that, is providing what's referred to as like a dental spa. So you want to provide that level of comfort, that level of care, but also make someone feel like, wow, like this is not the norm of what I've usually had, where everything's very sterile and very almost fear-inducing because there's promotions outside of like the needles and things like that. It's more of how do we make you feel at ease 24/7 while you're here, right? So I do see it's quite large in America right now, where a lot of dental practitioners also have either a nurse practitioner with them doing injectables, providing, laser therapies. A lot of that is happening in America already, because I just feel America's usually 5 years ahead of us when it comes to things like that, in terms of injectables, in terms of what we can do that's regulated, And so for me, I do think dental spas are going to become the norm, because why not? People want to have that comfort. And
the appetite for risk in America is different than Canada.
Agreed. 100%.
It's different than the entire planet. So often what you end up seeing is America is ahead, and you have usually what's fostering there and doing well can be implemented elsewhere, right? It's why, their stock market is, from a market cap valuation, is 67% of the entire globe, while their population is
nowhere near that.
Not even flipping close, right? It's truly staggering, actually. So they export their innovations to other countries, and if you're really paying attention, you can pay attention to whatever is happening in America is likely coming your direction if it's successful. So I think the customer in Canada is noticing what you've suggested. But what you said a little bit earlier, maybe 15, 20 minutes ago, you talked about corporate dental. That's where you started your practice.
Yeah.
What does that mean?
So basically a DSO, which is a large organization that owns several practices. So once you get above 5, you're usually a DSO. Okay. So what that means is you are a corporation. Now there's different ways of kind of going about it. You either brand yourself, all of the practices being a singular brand, or you could just be one large corporation that owns all the said offices that are basically their own private entities to the public.
Okay.
So there are different ways of kind of going about it in terms of a DSO, but for me, I wanted to build my own brand. I wanted to be my own kind of dentist in Edmonton, and I feel like being part of a corporation, it is tough. It is tougher to do that. Right?
It's hard to
stand out.
Yeah, and iterate quickly.
Yes,
when needed.
And putting and you can obviously agree with this point here, is that when you develop something and you're so successful as a corporation, that's the norm. So if someone wants to do something a little bit different, it is not usually going to work out. You need to either be part of the DSO's way of doing things, or you kind of, it just really doesn't work out, right?
Fair enough. So where do you see, from at least what I've noticed, and this is kind of a trend that I love to pay attention to. If you are looking at, if you're on Instagram a lot, you're on TikTok a lot, what you'll see is, I think, at least in the past, there's this thing called the Instagram face, which was everybody trying to cultivate a certain look, a stylized life. And the leaders of that were Emily Ratajkowski, the Kardashians, the Jenners, and they really push, and they still do to this day, where people are investing their time and money when it comes to their look. They drive that direction. What I've seen is a change in how they're stylizing their face, their bodies. And from my point of view, I view this as an investment opportunity. Where are we headed here? Where's the puck going? Because they are the ones that are carrying it.
Absolutely.
I think the work that they're having done is totally different than it was 8 years ago and 5 years ago, even 3 years ago. And that is going to have a major impact on dermatology and the deliverables at our spas. So if you look at the market cap of Botox, the Botox business, I actually can see that there's a crack in that business in what's currently happening, because I believe there's less Botox being delivered, and there's likely going to be less Botox delivered in the future versus what the anticipated growth rates were. And I think that that's directly because of what's happening to these influencers. What do you see from a spa perspective happening? You, prior to this, when we set up, you were talking about needling.
Yeah.
What are the spa?
I can kind of speak to what I've been exposed to recently. That's basically my expertise within it. And you speak about injectables, like I do Botox as well. I find, the main reasons I brought on Botox to my practice was therapeutics. So what I mean by that is injections for motor vehicle accidents, injections for TMJ issues. I've seen such
TMJ issue.
So great question. So when people have continual migraines, when people, there's a huge therapeutic aspect of Botox that a lot of the public is not actually aware of. So whenever I have patients come in, I ask them, do you have any jaw pain, any migraines, any issues like that? If they say yes to any one of those on their patient checklist, I give them the spiel of what Botox can do for you. And most of them are caught off guard. They're thinking, you're going to change my face and what I look like.
Exactly what
and that's why. So for me, injectables, I agree with you that my vision of what I've seen so far is Botox is still king when it comes to doing fairly minor cosmetic changes. Fillers are huge now. I'm seeing younger and younger patient base wanting fillers. And it's more of either a preventative aspect or just kind of the look that they're going for, which you had referenced, right? So I do believe that society and the way that it kind of gauges and values beauty really does affect how
100%.
The rest of our treatments go, right? So what I was referencing to you in that conversation prior to the setup here was that micro needling. So for example, there's the Potenza, the Picos, the Hollywoods, the Ultras. Those are really good at doing minor changes without completely altering how you look. So what I referenced to that is like fillers will provide a loss of value where they're injected. So when you have volume decreased and you add filler, well, that changes what your face actually appears and looks like in terms of the volume that's there. Microneedling can help tighten things, can help remove possible, differences in the skin pigmentation and things like that. So I see a lot of dental offices utilizing that because A, it's actually quite easy to learn and implement into your practice, and B, a lot of patients do trust their dentist because of our extensive knowledge of the head and neck anatomy. So it goes hand in hand, and that's why it works well in America. But I just think it also depends where you live in Canada. We're a patient base and a client base that there is a lot of cosmetic dentistry that wants to be done, a lot of cosmetic things for people's faces. I've been to a lot of dermatologists' offices, and the success that they have is it makes it very clear that this is still a consumable that people want.
Oh yeah, and I should throw an asterisk and a caveat in here. I don't believe it's going anywhere.
Oh no, absolutely.
So when I think about in my businesses growth rates and whether it be slowing or increasing, and because that is what changes the price. So it's not all or nothing. It's truly a change of pace can make a massive difference, right? So when I look at healthcare more broadly, I'm trying to figure out what is going on in society. Where can I see opportunity? So from aesthetics really seems to be like the integration where most of these businesses are going. So for me, I'm also noticing a lot of, you spoke to tightening. Needling provides tightening. There's a lot of plasma laser being done where women are doing neck and I shouldn't say just women, all people are doing
women.
Where they're I'm not exactly I don't know what's actually happening here, but they're tightening your neck all the way up. They're doing it after, and everybody has heard about Ozempic and Wegovy and what that's done to society, and what it's likely to do over the next 10 years is dramatically change people's bodies, and that'll require additional work as a result. Tightening around hips, legs, all the way down. Is this something that you view is coming your direction?
I mean, that's a great question. I think
these tightening products, I feel like this is for sure.
I could see it being a trend now, especially with the idea of Ozempic, for example, that you brought up. It's been, broadcast to us as a population here for the miracle drug. It will.
Eli Lilly and Novo Nordisk are nearly $1 trillion companies.
Yeah,
it's shocking.
Yeah, and I think that just speaks to where we are in society of how much we value beauty. Beauty will, and it's from, you can go as far back as you want, the movies in the 30s to now, and how much people value beauty. And I think it's more because social media makes everything so accessible that you can literally market anything and everything. I think that's where this push has been towards utilizing things that are quick and easy. We all want things to be done quick and easy. And when you can do that without having to really
too invasive,
that's where I think a lot of people are going towards that laser therapy, injectables, Botox, for example, because of its ability to have to be re-injected every 3 to 4 months. So if you didn't like how you looked, well, 3 months later, you'll be back exactly how you were, right?
So you know what I'm noticing, and this is now I'm pushing a little bit a different direction, and Canadian healthcare has always been reactionary medicine. Something bad happens, you break your leg, you go in. You have a sickness, you go in and see the doctor. What I'm seeing in people, they're taking a greater interest in their preventative medicine, staying healthy for longer. I want to live to 150. There's those folks on Twitter and Instagram that are like, I'm literally reverse aging myself. I was 55 yesterday, now I'm 37 today.
Biologically.
You dive into this like deep rabbit hole, and there is a broad amount of product and opportunity to be seen. And what I'm noticing is, whether it be on a Rogan podcast or You go across to like Skinny Confidential, where there's a larger women audience, and they're talking about the same things. And it is this preventative medicine movement. And what that is it's dietary, it be a different style of weightlifting, training your body, and what you do on a day-to-day basis. And how do you view that opportunity being added to the current practices? Because to me, and what I'm noticing, and in Calgary, they have a few preventative medicine shops that have opened up. There's now 2 in Edmonton. It feels as though this is where the puck's going from a general practitioner perspective. But I view all 3 of these practices as coming together: dermatology, dentistry, and general practitioners having a lot of overlap with aesthetics and with spas and with the future of healthcare, because the spend there is expanding. People care about what they look like, living longer, having a more comfortable, satisfying life. So there's an unlimited space here. It feels like this is a very fast growing pie. Let's grab our slice.
Yeah. So, it's funny because we always look at the market of preventative care as something that only you should be invested in as a individual if you have expendable income, for example, right? Oh, I'm going to do this excess treatment. I'm going to do A, B, and C because it makes me feel better. But we always have this stigma that we shouldn't be spending money on preventative care. And I agree to that point of, we are a very reactionary industry in terms of all of healthcare. But that ability to just spend the money on preventative is a very untapped market that actually can grow very easily if you just implement it the proper ways into your business. So for us, for example, when we talk about preventative maintenance in terms of your hygiene care and things like that, that's how we try and get you guys to understand, if you come in and do these things regularly, this is preventing you from needing that expensive care down the road.
You're not going to need that.
You're not going to need, you're not going to need the expensive forms of dentistry if you just kind of abide by the guidelines that we give you for your own oral health. And that's the same thing I feel like a lot of these industries, especially the beauty industry, is now pushing. You can prevent that facelift surgery that you may need in the future by doing these preventative things now. And it shouldn't be seen as, oh, you shouldn't be doing that stuff, you're so young. Like, there are things we can do to help slow the aging process that you're talking. So why should we feel stigmatized and, oh, you're being too shallow? No, like, these are things that can help prevent you from needing the major different cosmetic surgeries down the road, right? So I'm all for it. I think a lot of our patient base, for example, their main thing that I've always been told is, I just want healthy teeth, doc. That's what I care about. And I give them the phases of how I go about the dentistry with them. Is phase 1 is we want to maintain what you have. So we want your foundation, your gums, your teeth to be solid. Phase 2 is when we can go into that cosmetic stuff, the big treatments that need to be done. And phase 3 is your maintenance, right? And so maintenance is preventative. When you do the right things, that's when you don't need heavy dentistry, heavy aesthetics, because you're maintaining what you already have, right? So no, I'm all for it. I think it's a huge thing to add.
Okay, I want to shift gears and then talk a little bit about like the different stuff that gets done in a chair. So I have 2 young children. When I was a kid going to the dentist, it was like you had retainers and braces. What else is going on for children these days?
I mean, I think the biggest thing for children's dentistry is just being aware of the signs where you need to step in earlier. So for example, we have some kids that come in that we already know that this child is probably going to need orthodontic care. So ortho is, the movement and shifting of teeth in order to get into a proper position. That also what a lot of parents don't understand that bring their children in, and we try and educate them on, is it is purely a domino effect. So if the teeth are not in the right position, then the breathing ability of that child is actually hindered because their tongue can't rest in their mouth the way we want it to. And then it's just literally dominoes falling step by step. So for me, It's more being active in terms of their preventative care. Again, like we spoke to, preventing the need for future, longer, more difficult treatment by just being proactive, right? So that's the big thing I see. Number one is airway issues. A lot of children are having airway issues, and a lot of studies show it's because ever since the Industrial Revolution and we changed to a soft food diet, our jaws are not developing. So a new concept that's coming out more is
getting kids to have gum. Start chewing gum.
No, it's myofunctional therapy.
Okay.
So a new thing that's developing more now is myofunctional therapy.
Okay.
So with that, you're not just altering the position of the children's teeth, you're actually trying to musculoskeletally change the shape of their jaw, their ability to breathe, their just overall facial structure, which then allows them to have a longer, healthier, easier life.
You start telling parents this, and they're going to start flipping out. Because we already we're so scared of every little thing that might the millennial generation. We had so much additional time to worry about new things. You think about what your parents actually thought about when they were younger, or rather when they were raising us when we were kids. They didn't have the time to even think about the idea of altering their kids' facial structure from 2 to 8, but now we do.
Yeah, and I think
it's shocking.
You remember that book that I had mentioned to you that I think you should read. I think it would be it's a bit of a dry read, but it's really valuable in terms of the idea that you can truly change the outlook of your child's future by implementing steps. And that's where I look at it as the dentist. I have that ability to recommend that to parents. Now, what the parent does with the child is completely their decision.
Totally.
But my job, I find, especially with GCD, is implementing this idea as my job is to educate you at all costs, whether it is something that you want to hear or not. It's in the delivery and the approach of this is in your best interest. In the end, it is totally your call. And that's the biggest thing is with kids, most of my parents they're all on board because, I mean, this is their child. Anything that they can do to help have them have a better life, they're all for it. Right?
Absolutely.
Yeah.
So start working up the age stack here. You start having early teen, perhaps 10 to 13-year-olds is when their bodies are changing the most. What kind of stuff's getting worked into their body?
So the biggest thing that I notice with my teens and my preteens and things like that, just ortho treatment. They want the perfectly straight teeth because Joe in their class has Invisalign and then Rebecca has, the old school brackets with wires. And there is this idea that perfect smiles mean perfect health, right? And so a lot of kids that come in, they always tell me like, Doc, my best friend has his Invisalign stuff. The other big thing is just sports guards. A lot of kids are really into now, obviously, more of we get at that age range, we're getting into hockey, we're getting into soccer, we're getting into physical sports like that, rugby and things like that. So we try and just accommodate their needs in terms of what's actually good for them. But two, we like to play into the cosmetic stuff too. If they want a mouth guard that has like a logo on it, we get it done for them, right? But that's where I think the kids themselves, when you spoke about the social media, that's what they're seeing. They're seeing the influencers on YouTube with the perfect smiles. They're seeing all of these kids that are around their age range just having a certain look and style to them, and they want that, right?
And that's like, you know what, if you're a young investor looking at cues, to me, it's so obvious. If you can pay attention to influencers and what they're doing, directionally, you can see where things are going. And it's definitely a hack that I have. Whether or not it's unique, I don't really care. It definitely works. If you can just view and look at, even heck, I told my wife that she should think about getting a Goyard bag in 2019 because I saw Ezekiel Elliott carrying one into practice.
So
and I'm like,
fantasy football did you well.
Honestly, Sundays made a little bit of made my wife happy.
Yeah,
anyway.
exactly.
And if you can spot these cues, and I think more people are doing it more and more frequently, but it's not as simple as just like the clothing that they're wearing. It's very much the way that you end up manipulating your body and what you eat and all those sorts of things. So when I do, and why I wanted to drive this conversation and have you come and sit down and talk, I really felt like you viewed things similarly, and I was very excited to see. I mean, you've opened up an office in my neighborhood. I'm hyper interested in the space. If you think about Alberta versus the rest of the country, it seems like you're definitely innovating here, whether it be because of the billing rules versus the rest of the country, or whatever it might be. Alberta is always unique from a federal perspective because we are taxed the least. We're definitely, just from a demographics perspective, the youngest. If you view whether just per capita GDP, we have a little bit more money to spend. Alberta is always on the leading edge for Canada, and I view healthcare as being a total addressable market that's growing. Our population is on fire. I mean, we're going to be a 2 million population in Edmonton and greater Edmonton area within the decade. It's such an incredible opportunity. And I really think that pie that you've found yourself selling a service into is growing and is an amazing opportunity. So I'm thankful that you were willing to come in and chat about it. I'm definitely going to be picking your brain further and down the line and into the future. But I think from a podcast perspective and from an investment perspective, I'm thankful, but also excited for what you're getting yourself into. It's really cool to see a startup and the corporate dental side versus what you've got going on. To me, is really a differentiation. And I think for myself, my entire life, I've only gone to practices that are owned and run by individual owners. And I think that matters.
Absolutely. You know, to add to your point about Alberta, like, I mean, we're, as somebody like you would know, we're one of the leading tech places in all of Canada, right? Yeah. Amazon wants to build warehouses and facilities here, right?
We got cheap energy.
We got cheap energy too, right? So for us, I just look at it as, if we just continue to keep noticing certain trends and details, and what I like about you and why I was really engaged in this conversation was, you have a very analytical mind of how you look at details, which reminds me of me when it comes to dentistry, because my whole life is details. When someone's bite is changed by 1 millimeter, that affects their entire day-to-day life.
Yeah, so I wish I didn't have such a terrible...
So that's why when I look at it and think, I'm looking at such minute changes within someone's mouth, I want to then apply that to the rest of the body, the rest of the field, the rest of the population base that we have, because we can grow once we just stop and look at things in the moment. I feel like a lot of us, including myself, we're guilty of always looking either in the past or forward, what's ahead, and just being in that moment and being able to identify certain niches, certain misses, certain successes. That's what will allow us to continue to grow, right? And I'm all for it, and I really do appreciate the time you took to have me out here.
Oh, I'm thrilled. It's too bad that we had freezing rain last night. It was an absolute gong show getting in here, but
and then me spilling coffee everywhere is just another.
You can't see it on camera.
Yeah, so we're okay.
Yeah, absolutely. Well, thanks.
Thank you very much, Joel. Absolutely, yeah.
And that was fun.
Yeah, very fun.